Welcome to this training video on vital signs monitoring. Pharmacy staff play a crucial role in ensuring patients' health by monitoring vital signs, offering guidance and supporting continuity of care. This video will cover the importance of monitoring vital signs when to consult a doctor and how recording data in the MyHealth app enhances care. We will also discuss related medications and conditions that require regular monitoring. Vital signs provide key insights into a patient's health and are the foundation of continuity of care. The four primary vital signs are blood pressure, heart rate, body temperature, respiratory rate. Additional measures like oxygen saturation can also be important. Monitoring and recording these vital signs in the MyHealth app ensures a seamless connection between patients, pharmacists, and healthcare providers, enabling better care decisions. Let's review each vital sign in detail. Blood pressure reflects the force of blood against artery walls. It's a critical indicator for conditions like hypertension, heart disease, and kidney disease. Normal range. Less than 120 over 80 millimeters of mercury is optimal. Conditions that require monitoring. Patients with hypertension, diabetes, or chronic kidney disease should monitor BP regularly. Key monitoring tips. Ensure the patient is seated with their arms supported at heart level. Avoid measuring BP immediately after exercise, caffeine intake, or stress. When to consult a doctor. Readings persistently above 140 over 90 millimeters of mercury may indicate hypertension. Readings below 90/60 millimeters of mercury may indicate hypotension. Drugs requiring monitoring. Amlodipine, Losartan, and diuretics, like hydrochlorothiazide, require routine BP checks. MyHealth tip. Encourage patients to record their BP readings in the MyHealth app to track trends and share with healthcare providers. Pharmacy staff can recommend subscription to monitoring services for regular follow-ups. Heart rate measures how many times the heart beats per minute and is essential for monitoring conditions like arrhythmia, heart failure, or anxiety disorders. Normal range, resting heart rate for adults is between 60 to 100 beats per minute, BPM. Conditions that require monitoring, patients on medications like beta blockers, e.g. atenolol, or those with arrhythmias need regular pulse checks. Key monitoring tips. Use a timer to count beats for 30 seconds, then multiply by 2. Check rhythm regularity. Any irregularities should be documented. When to consult a doctor, pulse below 60 beats per minute, bradycardia, or above 100 beats per minute, tachycardia, at rest requires further evaluation. MyHealth tip. Encourage patients to log pulse readings and symptoms like palpitations or dizziness in the app. This ensures continuity of care and helps healthcare providers make informed decisions. Body temperature is a key indicator of infection, inflammation, or illness. Normal range, 36.5 degrees Celsius to 37.5 degrees Celsius, 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit. Conditions that require monitoring. Patients with infections, post-surgery, or on immunosuppressive therapy need regular temperature checks. Drugs requiring monitoring. Patients on antibiotics like amoxicillin/clavulanic acid or antipyretics like paracetamol should monitor for fever reduction. When to consult a doctor. Fever above 38 degrees Celsius, 100.4 degrees Fahrenheit, or below 35 degrees Celsius, 95 degrees Fahrenheit, may require immediate medical attention. MyHealth tip. Advise patients to record their temperature readings and related symptoms, such as chills or fatigue, in the MyHealth app. This data supports continuity of care and helps detect patterns. Respiratory rate and oxygen saturation are critical for detecting respiratory issues. Normal respiratory rate, 12 to 20 breaths per minute. Normal oxygen saturation, 95 to 100% for healthy adults. Conditions that require monitoring. Patients with COPD, asthma, or respiratory infections like pneumonia need regular checks. Drugs requiring monitoring. Patients using bronchodilators like salbutamol or corticosteroids for asthma should monitor their breathing. When to consult a doctor, respiratory rate above 25 breaths per minute or oxygen saturation below 90% may indicate respiratory distress. MyHealth tip. Encourage patients to log breathing patterns, oxygen saturation, and symptoms like shortness of breath in the app. This ensures timely follow-ups and improves outcomes for chronic respiratory conditions. Many conditions require regular vital sign monitoring to optimize medication effectiveness. Antihypertensives, drugs like Losartan or Amlodipine require BP monitoring. Diabetes medications. Drugs like glibenclamide may need additional checks for hypoglycemia. Antibiotics. Patients on drugs like ciprofloxacin or metronidazole should monitor for fever reduction and side effects. Counseling. Tip: advise patients on how monitoring their vital signs supports medication adjustments and improves outcomes. Remind them to document all readings in the MyHealth app for continuity of care. Through the Clinical Professional Pharmacy Services (CPPS) initiative, pharmacies can expand their role in patient care by offering pharmaceutical consultations, monitoring, and medication management. By leveraging tools like PharmCare and MyHealth, your pharmacy can improve patient outcomes while making money in a new way to increase the income of pharmacies. CPPS not only supports better health for your patients, but also positions your pharmacy as a leader in proactive, patient-centered care. Thank you for watching. Together, let's enhance patient care with knowledge and technology. Call or WhatsApp us on 0200-193-771. Visit our social media handles. Let's enhance patient care with knowledge, compassion, and technology. Thank you for watching.